Hello. Tonight's story is titled How Advanced Was Medicine in the Middle Ages? Methods of Treating Patients. If this kind of storytelling helps you relax and fall asleep, feel free to like the video and subscribe to my channel, and let me know in the comments where you're listening from and what time it is as you drift off. Now, if you're ready, turn off the lights and create a peaceful environment for yourself, accompanied by the soft crackling of a fireplace in the background. Let's begin this gentle and immersive story. In the dim corridors of early medieval Europe, earlier than the formal structuring of clinical guilds and the founding of institution colleges, there existed a worldview wherein well-being, ailment, and therapy weren't noticeable, mainly as concerns of the physique, but instead as concerns of the soul, the heavens, and divine windfall. Remedy, in this atmosphere, was neither thoroughly empirical nor totally superstitious. However, instead, it was once a gradual and layered synthesis of classical inheritance, devout doctrine, and customary wisdom passed from new release to iteration, on the whole by way of handwritten texts or oral reminiscence. The practice of healing within the early medieval period did not follow a single universal procedure but used to be shaped through geography, monastic traditions, local weather, available vegetation, and ecclesiastical authority. What emerged was not a procedure of dramatic innovation, but one among continuity, repetition, and gradual adaptation, the cornerstone of scientific working out. Throughout the early century, while was deeply rooted in the legacy of scholarship, primarily the writings of Galen and Hippocrates, that have been preserved, interpreted, and modified by using later scholars. These works, in most cases translated from Greek into Arabic, after which into Latin, formed the most important body of medical knowledge to be had to people who have been literate and or fortunate ample to gain knowledge of them. Nevertheless, these texts had been most commonly incomplete, copied by means of hand, and disciplined to gradual corruption through transcription mistakes or deliberate alteration. Hence, medieval medication grew upon a basis of inherited talents that was each revered, and, now and then, misinterpreted. The authority of the textual content mattered greater than the commentary of signs, and deviation from classical dogma was not often inspired. The human physique, consistent with prevailing medical theories, was understood by way of the theory of the four humours: blood, phlegm, yellow bile, and black bile. This process, originating in ancient Greek notion, used to be widely accredited for the duration of the medieval interval and continued throughout centuries with fairly little fundamental exchange, while being used to be visible as the right steadiness of these humours, and sickness was suggestion to come up from their imbalance or corruption. Diagnosis involved the remark of urine, the assessment of the pulse, and the distinction of goals or behavioral changes, all inside the framework of humoral concept. No subtle devices have been used. As a substitute, there was once reliance on the practitioner's reminiscence, classical training, and individual intuition, frequently colored by means of devout conviction. The Church played a massive position in shaping the belief and apply of remedy in the course of this period. Disease, for many, was no longer merely a physical soreness, however, a non-secular trial, or a punishment for sin. Monasteries functioned as both religious facilities and sensible areas for the care of the ailing, and it was regularly the monks who preserved ancient clinical texts, cultivated medicinal herbs, and furnished rudimentary care to the encircling population. Cure saints were most commonly invoked, and relics were used within the hope of divine intervention. Prayers, penance, and the anointing of the ill were religious treatments that paralleled, and typically replaced, the applying of physical cures. The overlap between hospital therapy and religious obligation used to be no longer noticeable as complicated. However, as an alternative, as normal and correct, hospitals, reminiscent of they existed, were mostly extensions of monasteries and had been particularly charitable associations as a substitute than centers for medical innovation. Their operate used to be much less about curing disease and extra about providing comfort, cleanliness, and Christian charity to the terrible and infirm. Beds had been shared, assets have been limited, and the size of a sufferer's stay depended much less on their healing and extra on the institution's ability to present ongoing help. There was little try and isolate ailments or recognize contagion in the today's experience, and most sicknesses were noticeable by way of the lens of divine will and non-secular battle. Clinical schooling, to the extent that it happened, used to be casual and inconsistent for the period of this time. Most practitioners had been both clerics with entry to books, barbers who carried out minor surgeries, or nearby intelligent women, and herbalists who possessed realistic competencies of vegetation and cures. Licensing did not exist in any formal experience, and the honor between a proficient healthcare professional, a barber healthcare professional, and a folk healer used to be most of the time uncertain. The talents these members possessed was once bought via apprenticeships, private expertise, and oral culture. There had been no standardized curricula, no regulatory or bodies, and little conversation between practitioners across regions. Some of the essential texts influencing medieval scientific apply was the Physica of Hildegard of Bingen, a Benedictine abbess whose writings combined herbal medication, natural philosophy, and theological reflection. Her work exemplifies the blending of empirical statement with mystical perception, a hallmark of early medieval cure. Yet another commonly used textual content used to be the Herbarium of Pseudo-Apuleius, a compilation of herbal remedies that persisted in use long after its compilation. These texts have been copied in scriptoria, where monks labored patiently to transcribe each and every web page with the aid of hand, an approach that ensured the preservation of skills but also restrained its dissemination. Remedy within the early Middle Ages used to be no longer practiced with expectation of swift therapies or dramatic interventions. Alternatively, it used to be a slow and contemplative effort to revive balance, ease struggling, and fulfill a moral responsibility to care for one's fellow man. Therapy generally started out with prayer, endured with simple remedies akin to poultices or herbal infusions, and concluded with non-secular steerage. The use of leeches, cupping, or bleeding was not uncommon, though these have been employed more as a method of restoring humoral equilibrium than as aggressive clinical tactics. Surgery was once rare and seen with suspicion, undertaken most effective when definitely integral and usually reserved for battlefield wounds or instances of obvious injury. Pharmacology, such because it existed, was restrained by means of the provision of materials and the upkeep of recipes. Drugs had been constructed from herbs, animal merchandise, and minerals, combined according to formulae that had been passed down or copied from old texts. The practice of these remedies concerned grinding, soaking, boiling, or drying, and high-quality care was taken to be certain the correct timing and ritual purity of the approach. The lunar cycle, astrological considerations, and devout feasts all performed a role in selecting when and how medicines will have to be administered. Efficacy was judged now not by means of outcome on my own, however by adherence to common system. Herbal gardens were original in monastic communities, and the cultivation of treatment crops akin to sage, rosemary, comfrey, and yarrow was regarded a pious and priceless venture. These gardens had been specified by orderly rows, tended with quality care, and documented in easy drawings or marginal notes. Some monasteries compiled rudimentary pharmacopoeias. At the same time, others maintained a document of victorious cures and recipes. Though these had been rarely shared outside the cloister, the sharing of clinical knowledge was once cautious, managed, and on the whole confined by way of linguistic and geographic limitations. Astrology, too, played a significant function in scientific analysis and remedy. It was once widely believed that the actions of celestial bodies influenced the well-being and temperament of members. Physicians generally consulted astrological charts before picking out a path of cure, and manuals of scientific astrology have been circulated among these experts within the liberal arts. The zodiac was once considered imperative to specific ingredients of the body, and therapies have been timed to coincide with favorable planetary alignments. Though cutting-edge readers may just view such practices as faulty, they were regarded rational and scientific inside the intellectual framework of the time. The absence of dissection or certain anatomical gain knowledge have additionally outlined this period of scientific history. The human body used to be rarely opened, both as a result of devout prohibitions or useful boundaries. What was once recognized of internal anatomy came mostly from animal dissection, textual description, or inherited belief. As a result, many misunderstandings about physiology persevered. The center, liver, and mind were ascribed functions headquartered extra on symbolism and classical authority than empirical observation. The circulation of blood, for example, was once poorly understood, and the position of organs was once customarily Despite these limitations, the intention of medieval medicine was once to not revolutionize but to maintain. Practitioners aimed to hold the wisdom of the ancients, to take care of the unwell with compassion, and to align their observe with the moral teachings of the Church. Cure used to be no longer become independent from the spiritual existence, and the surgeon used to be, as a lot, an ethical consultant, as a clinical trained on this approach. The foundations of medieval treatment have been laid no longer with the ambition of discovery, but with the intent of faithful carrier. Consequently, the early medieval period offers an image of treatment that is methodical, reverent, and static. There's little to advocate speedy development or dramatic breakthroughs. However, there's much evidence of cautious upkeep, quiet labor, and enduring culture. In the following section, we will notice how these foundational suggestions have been step by step multiplied, challenged, and sophisticated with the emergence of institution-centered medicine and the gradual professionalization of the medical arts. As the early center ages gave solution to the excessive medieval interval, a gradual shift started out to take location within the landscape of clinical idea and follow. This shift used to be not abrupt, nor used to be it innovative in the feel of modern-day scientific progress. Instead, it unfolded slowly, over generations, across the centuries of the 12th and 13th centuries, and into the 14th, characterized, through the quiet consolidation of classical potential, the institutionalization of finding out, and the slow, deliberate formation of a clinical profession, bound with the aid of customized curriculum and ecclesiastical approval. The procedure was uneven, normally hesitant, and marked by using a steady negotiation between religious orthodoxy and emerging scholastic inquiry. With the upward push of European universities, first at Salerno, then at Bologna, Montpellier, Paris, and Oxford, remedy used to be progressively absorbed into the broader intellectual structure of formal schooling. These institutions didn't emerge as isolated innovations, however, as part of a broader ecclesiastical and administrative effort to furnish constitution to learning across quite a lot of disciplines. Treatment, together with legislation and theology, came to be studied according to set texts, predetermined curricula, and formal examinations. The constitution used to be inflexible, the percent slow, and the emphasis positioned extra on the mastery of authoritative texts than on independent commentary or experimentation. The Articella, a scientific compendium that compiled and reinterpreted works by means of Hippocrates, Galen, and later Arabic commentators, similar to Avicenna and Rhazes, became one of the vital foundational texts for the betrained of medicine in institution settings. The Canon of Remedy by Avicenna, translated into Latin by way of Gerard of Cremona in the 12th century. Editio solidified the have an impact on of Islamic scientific scholarship on European studying. These texts have been regarded now not only as priceless assets, however, as definitive authorities, and their betrained was, by and large, undertaken with a reverence extra similar to theological exegesis than scientific inquiry. Scientific schooling followed a clear and repetitive route. Pupils were required to be taught the liberal arts, frequently for a couple of years, earlier than being admitted to the study of remedy. Guide was once conducted by means of lectures, commentary, and disputation. Scholars memorized passages, engaged in rote studying, and participated in guided discussions. Often in Latin, there were few possibilities for hands-on observe, and scientific observation used to be constrained. Dissection was once discouraged, and anatomy was taught via diagrams, animal models, and textual description. The emphasis was once no longer on empirical verification, but on demonstrating fidelity to authorized doctrine. The procedure of fitting a healthcare provider was once lengthy. It involved a number of years of be taught, the passing of examinations, and, more and more, the acquisition of a license to observe. Licensing was offered progressively, opening in the 13th century in proponents of Italy, and spreading across Europe within the following centuries. The purpose used to be not in basic terms to manipulate entry to the career, however, to make certain that scientific practitioners had been adequately knowledgeable, morally upright, and ecclesiastically accepted. Bishops and tuition authorities performed a relevant role in granting licenses, and failure to acquire such authorization could outcomes in fines, excommunication, or authorized sanction. Despite these formal constructions, the scientific occupation remained varied and stratified. Collegian-formed physicians, known for their schooling and command of Latin, have been special from barber surgeons, who engaged in handbook methods corresponding to bloodletting, teeth extraction, and wound dressing. Apothecaries in charge, for the practice and sale of medicinal supplies, occupied a further reliable tier. There were also midwives, herbalists, and folks healers, many of whom practiced without formal coaching or awareness. The boundaries between these roles have been quite often blurred, and cooperation or competition amongst them trusted regional, customized, monetary reasons, and social standing. College physicians have been mostly concerned with interior remedy, diagnosis, and prognosis. Their training emphasized the careful interpretation of signs within the framework of humoral conception. Sufferers have been examined by means of questioning, observation, and the inspection of bodily outputs, akin to urine, feces, and sputum. The practice of uroscopy, in certain, became a incredibly developed and ritualized approach of prognosis. Glass flasks of urine were held towards the light, and in comparison with diagrams indicating the humoral state of the sufferer. The presence of sediment, color alterations, or frothiness was used to deduce the nature and place of interior imbalances. Treatment strategies had been framed in terms of food regimen, routine, and tender correction. Physicians most likely prescribed lifestyle changes, akin to adjustments in sleep, undertaking, or the timing of ingredients. Medicinal recipes have been drawn from authoritative texts and adjusted established on the patient's age, gender, season, and astrological situation. Remedies might incorporate plant-established preparations, mineral powders, animal derivatives, and even materials of the human physique. These resources had been ready in keeping with long-standing systems, and much care used to be taken to make certain the accuracy of parts and dosages. Latin was the language of scientific finding out, and this created a certain separation between folks that had access to formal education and people who didn't. Clinical texts were written and studied in Latin, and prescriptions have been quite often delivered in the equal language. Sufferers who did not appreciate Latin needed to rely on interpreters or believe the authority of the medical professional. This linguistic divide reinforced the prestige of the school-proficient doctor, whilst additionally, except for enormous portions of the populace from understanding the foundation of their remedy. Within the tutorial setting, debate was once inspired, but best inside the parameters of permitted doctrine. Scholarly commentary on Galen or Avicenna might be wide and targeted, but questioning the validity of the humoral mannequin itself used to be rare. Observational discrepancies were regularly explained away or reconciled with established thought. Innovation used to be not the goal. Renovation and elaboration were viewed extra essential. The intellectual atmosphere prized continuity and textual mastery over sensible efficacy. Clinical faculties almost always had ties to cathedral schools or clerical networks, and physicians have been routinely ordained clerics themselves. This twin function used to be now not regarded contradictory. The therapy of the physique was once seen as an extension of pastoral care, and the moral standing of the doctor was once considered as important as his technical potential. Moral codes have been drafted, although enforcement used to be inconsistent. These codes emphasized modesty, sobriety, discretion, and avoidance of greed. Physicians have been discouraged from making extravagant guarantees or boasting of magnificent treatments. Hospitals, for the period of this interval, commenced to take on an extra-organized structure, peculiarly in urban centers. Even as nonetheless, above all, charitable associations, some hospitals began to hire tuition expert physicians, exceptionally those associated with devout orders or wealthy patrons. These associations were most likely segregated via ailment, gender, or social popularity. Separate wards have been created for lepers, the mentally in poor health, and the terrible administrative records were saved, and inventories of presents have been maintained. Sufferer rolls had been compiled, and a few rudimentary efforts at report preserving were undertaken, though these were, as a rule, sporadic and field to loss. Surgical procedures started to be practiced more openly, although it remained break-free the area of institution physicians. Barber surgeons had been trained by way of apprenticeship instead than formal learn, and their ways were generally seen with suspicion by means of the educational elite. However, surgical manuals commenced to show up, detailing methods for hernias, abscesses, fractures, and cataracts. These texts have been typically illustrated, though the best and accuracy of illustrations diversified broadly. Instruments such as lancets, cautery irons, and forceps had been used, and antiseptic practices, as they are now understood, had been mostly unknown. Hospital treatment continued to be shaped by means of the seasons and the stars. The influence of astrology remained strong, and the selection of days for medication was ruled by using almanacs and planetary charts. Bloodletting, for example, used to be timed in step with the position of the moon and zodiac. Specific hours have been deemed propitious for administering purgatives or conducting surgical procedures. These practices weren't regarded superstitious with the aid of cutting-edge requisites, however have been seen as rational functions of cosmic competencies. Some of the main medical facilities of the period used to be the School of Salerno, placed in southern Italy. It served as a bridge between Latin, Greek, Jewish, and Arab traditions, and its impact extended for the period of Europe. The routine Sanitatis Salernitinum, a poem on hygiene and health, grew to become greatly circulated and translated. It supplied advice on food plan, sleep, sex, and emotional good-being, all couched in humoral language and framed as moral guidance. The popularity of this article reflects the growing curiosity in preventive medication and the cultivation of wellness as a lifelong self-discipline. Scientific licensing, with the aid of the later Cora Weil, grew to become extra-formalized. In some cities, practitioners have been required to show up earlier than a panel of examiners, furnish evidence of gained knowledge of, and reveal advantage of common texts. Failure to comply would outcome in authorized action. Civic authorities, primarily in cities such as Paris and Florence, began to keep watch over the sale of medicines, investigate cross-check apothecary stores, and display public well-being. Though enforcement was once uneven, these tendencies marked a sluggish movement towards bureaucratic oversight and legit accountability. On the other hand, the boundaries of clinical follow remained porous. Herbalists continued to function in rural areas, and lots of men and women sought care from religious figures, nearby smart ladies, or unlicensed healers. The supply of trained physicians used to be restricted, specifically external fundamental. Cities and most medication persevered to rely on common remedies, simple routines, and household talents. The university-trained medical professional was nonetheless a minority presence, extra-traditionally consulted by way of the wealthy or influential than by means of the general populace. For this reason, the high and late core ages witnessed the formalization of medical schooling and the professionalization of the medical professional. However, these traits did not radically develop into the observe of treatment for many men and women. Instead, they created a layered procedure wherein historic authority, institutional finding out, and practical tradition coexisted in a slow and more commonly contradictory fashion. Talents used to be accrued carefully, transmitted cautiously, and questioned rarely. Innovation, when it happened, was once as a rule modest and framed as a correction, as an alternative, then a departure. In the following part, we will be able to explore how scientific practice was once influenced by trouble and disaster chiefly, how the advent of the black dyeing within the mid-14th century challenged prevailing theories, disrupted established methods, and introduced new attention to the limitations of natural scientific knowledge. As the 14th century unfolded, European societies, having constructed often upon inherited medical tradition, have been confronted with the aid of a sequence of catastrophic pursuits that will profoundly scan the intellectual, institutional, and realistic foundations of medieval treatment. Probably the most infamous of these pursuits was the plague, which arrived in waves commencing in the year 1347 and persisted to reappear intermittently for centuries thereafter. Identified today because the Black Death, the initial outbreak, in the mid-14th century led to well-known mortality, economic dislocation, and social upheaval. Nevertheless, the focus of this part will not be on the emotional or dramatic effects of the plague, however, rather on the slow and regularly repetitive, administrative, theoretical, and procedural responses that medical practitioners and civic authorities attempted in its wake. The advent of the plague used to be first found in southern Europe, with stories accomplishing coastal cities akin to Messina, Genoa, and Marseille. From these facets, it unfolded regularly along exchange routes, relocating inland via commercial and pilgrimage networks. Trendy medical working out lacked the modern-day notion of contagion situated on microbial theory, and so explanations for the disease assorted. Some believed that the plague used to be brought about by way of corrupted air, or miasma. which was proposal to come up from decaying natural and organic subject, earthquakes, or astrological alignments. Others attributed the motive to divine punishment for collective sin or ethical failings. A smaller quantity believed that poisons had been offered into wells and meals provides. Although the evidence for such beliefs used to be most often circumstantial and politically charged, the fashioned thread in medical explanations was once the strive to suit the symptoms of the plague into existing frameworks of humoral imbalance and environmental disturbance. The buboes, painful swellings of the lymph nodes along with fever, vomiting, and discoloration of the dermis, have been observed and described in Ailment. However, these symptoms weren't interpreted in phrases of pathogens or transmission. However, as a substitute, as indicators of inside corruption or the body's try and expel detrimental supplies. The rapidity of the sickness and the high mortality price were defined as results of cosmic affect or the overwhelming of the physique's common defenses. In keeping with the epidemic, medical treatises had been written and circulated. These plague tracts or consilia were traditionally composed through school physicians at the request of civic authorities. They included lists of advocated regimens, dietary adjustments, prayers, and approaches for purifying the air. Normal recommendations integrated the burning of aromatic substances such as rosemary, juniper, or frankincense, the avoidance of crowded locations and foul odors, and the consumption of light, simply digestible meals. The texts emphasized moderation, order, and the avoidance of extremes in emotion or exertion. Although diverse in element, these treatises shared a commitment to usual conception, and they rarely puzzled the foundational assumptions of medieval scientific doctrine. One largely circulated plague tract was once written by means of the Paris Scientific College in 1348, on the request of King Philip VI of France. This report summarized prevailing opinions, offered a theoretical rationalization of the plague's motives, and supplied a sequence of suggestions. The school attributed the ailment to a conjunction of planets that had passed off in 1345, which they believed had corrupted the surroundings. The response was framed as a mental exercise in consistency, alternatively, than an effort to revise present paradigms. The authors told persons to remain indoors, avoid bad smells, and balance their humors via bloodletting, purgation, and managed weight loss program. Bloodletting, already a customary observe, was adapted to be used in plague cases, although with combined results. Physicians endorsed timing the method according to astrological conditions and the progression of signs. Cupping, purging, and the application of poultices had been also told, although there used to be little evidence of efficacy. The persistence of common therapies, despite well-known mortality, reflects the deep inertia of medieval clinical pondering and the limited capacity for theoretical adaptation under drawback stipulations. Hospitals, already strained via persistent poverty and health problem, were quickly overwhelmed. Many associations lacked enough employees, beds, or clean services. Documents show that in a number of cities, whole hospital wards were deserted or repurposed for burial or quarantine. Some hospitals tried to segregate plague sufferers, although the methods had been inconsistent. Caregivers by and large died alongside their patients, and recruitment of new personnel was intricate. In some cases, civic authorities resorted to offering higher wages, guarantees of non-secular reward, or even legal compulsion to be certain that the ill received as a minimal concentration. Monasteries, convents, and different religious residences additionally experienced excessive mortality rates, particularly among folks who tended to the ailing. Monastic infirmaries, most likely reserved for inner use, have been commonly opened to the general public, though this varied via vicinity. The lack of skilled herbalists, scribes, and caregivers had long-term results on the renovation and transmission of clinical competencies. Monks and nuns who had previously managed herb gardens, copied manuscripts, or maintained hospital accounts had been more often than not changed with the aid of newcomers or lay administrators, whose familiarity with base routines was confined. The logistical response to the plague worried a kind of bureaucratic measures, together with the issuing of ordinances, the appointment of plague doctors, and the enforcement of quarantine. Municipal records from cities corresponding to Florence, Venice, and Milan incorporate specific entries regarding avenue cleansing, corpse disposal, and the legislation of journey. In many cases, civic councils hired participants known as watchers or searchers to investigate, cross-check houses, file sicknesses, and ensure compliance with isolation orders. Quarantine, mostly lasting 40 days, used to be utilized to ships, tourists, and suspected households, although enforcement used to be uneven and area to nearby discretion. Plague medical professionals, almost always depicted in later centuries, wearing bird-like masks and long robes, have been appointed by using municipal authorities to attend to the contaminated. Their predominant tasks: integrated analysis, record-keeping, and the supervision of burial methods. Payment was generally supplied in advance due to the high mortality hazard. These medical professionals did not always have formal medical training, and their approaches are sorted commonly. Nevertheless, their presence displays the try to arrange medical care within a civic framework, nonetheless constrained or improvised that framework may have been. The burial of the lifeless offered one of the greatest logistical challenges for the duration of plague outbreaks. Natural burial rites could not be maintained, and mass graves had been most likely used. Clergy had been regularly unable to behave man or woman offerings, and many deaths went unrecorded. In some cities, burial officers have been appointed to oversee interment and hold general hygiene specifications. The emphasis was once positioned on containment as a substitute, then mourning. The reuse of grave websites and the burning of infected belongings grew to be original practices, particularly in urban centers. Records of scientific deliver inventories from the period show that cities tried to preserve shares of vinegar, herbs, and linen bandages. Vinegar was believed to have purifying houses and used to be used for hand washing, apparel, remedy, and air cleaning. Herbs akin to rue, wormwood, and lavender had been placed in pouches or hung in homes. Easy linens had been used when to be had, though shortages were common. These practices have been headquartered on the principles of humoral stability and environmental purification, alternatively than on an understanding of illness or microbial theory. The continuation of academic medication for the period of the plague years used to be sporadic, however not totally suspended. Universities commonly closed quickly throughout major outbreaks, but instructing resumed when conditions allowed. Some plague tracts had been included into the medical curriculum, and scholars were motivated to learn the hobbies. As examples of environmental and cosmological disturbance, there's little proof that the plague ended in on-the-spot curriculum reform. Rather, it reinforced existing categories, such because the importance of regimen, the dangers of excess, and the need of ethical advantage in retaining well-being. The plague additionally ended in accelerated demand for astrological offerings. Physicians and astrologers were consulted to solid horoscopes, establish auspicious occasions for healing, and predict future outbreaks. Almanacs became more detailed, and planetary conjunctions had been recorded with care. The notion that celestial actions influence disorder remained dominant, and few sought to venture this view. The function of the surgeon thus remained both medical and astrological, and many persisted to be taught each disciplines in parallel. Efforts to keep watch over the medical career had been intensified in some regions. Licenses were reissued, charlatans were fined or expelled, and apothecaries have been inspected. In Florence, for illustration, city authorities passed new rules on the sale of drug treatments, the cleanliness of stores, and the educational of assistants. In Paris, the Faculty of Remedy issued additional recommendations for plague therapy and emphasized the moral responsibility of physicians. These efforts weren't universally applied, but they demonstrate the gradual bureaucratization of health care. Even in occasions of main issue, the social function of physicians grew to become more visible in the course of this interval. Though their capability to treatment the plague used to be restrained, their participation in civic and intellectual existence accelerated. They attended council meetings, advised on public well-being, and authored treatises. Their Latin training and connections to the tuition method gave them credibility, even when their cures had been ineffective. On this experience, the plague improved the physician as a figure of authority, though now not always of success. Lay responses to the plague incorporated the increased use of pilgrimage, prayer, and penance. Religious processions have been held, typically in violation of public well-being ordinances. The flagellant motion, where companies of individuals traveled from city to town, whipping themselves in acts of repentance, gained transitory popularity. These practices had been discouraged by way of church authorities, but their occurrence reflects the widespread belief that disease was rooted in sin. For many, religious purification was once extra obtainable than scientific healing. Despite the high mortality price and the disasters of present-day medication to discontinue the plague, there used to be little abandonment of medical idea, alternatively than prompting rejection. The activities of the plague resulted in elaboration, commentary, and reinterpretation. Humoral conception remained dominant, though efforts had been made to refine the classification of symptoms, the timing of interventions, and the composition of treatments. Scientific texts from the late 14th and early 15th centuries show a continuation of previous patterns, albeit with further references to plague-related experiences. In conclusion, the response to the plague was once no longer marked by using dramatic innovation, but by the reinforcement of current structures. Usual explanations were maintained, administrative routines were extended, and scientific follow endured to function inside a framework of authority, ritual, and inherited perception. Although the Black Dying represented one of the finest demographic catastrophes in European history, its outcome on scientific concept used to be largely conservative. It revealed the bounds of figuring out, the fragility of infrastructure, and the persistence of movements in the face of unusual mortality. Within the next section, we can flip to the sensible approaches of treating patients in everyday situations, detailing the ordinary scientific come across, the tools used, the fashioned therapies administered, and the environments wherein care was furnished. Our center of attention will remain calm, structured, and observational, emphasizing sluggish approaches and daily routines. The follow of treatment in the core a long time, when now not overshadowed by way of the infrequent, however devastating effects of epidemic ailment, was once mostly defined via quiet, predictable routines. These routines, grounded in both theoretical way of life and private experience, reflected the prevailing notion that ailment stemmed from imbalance, whether interior, environmental, or religious, and that healing must goal to restore concord through soft, measured, and deliberate interventions. The everyday realities of hospital therapy had been formed much less with the aid of dramatic intervention than by means of modest correction, modest statement, and modest expectation. In this section, we will compare in detail the components of that care, the areas it used to be administered, the instruments that were used, the elements that had been applied, and the ordinary sequence of movements that constituted the healing system for the ordinary patient in medieval Europe. Hospital treatment was delivered in a variety of settings, relying on the popularity of the sufferer, the character of the sickness, and the availability of professional help. The wealthiest contributors, certainly those associated with the nobility or the clergy, perhaps attended to in their own houses through a college-educated healthcare professional, sometimes accompanied through an apothecary or servant. The care furnished in such environments tended to follow the constitution outlined in today's medical texts, with attention to prognosis, regimen, and personalized remedy. For the majority of the population, however, therapy passed off either in small nearby hospitals, by the hands of a barber healthcare provider, or inside the residence, below the steering of a loved one's member, a midwife, or a nearby herbalist. These settings weren't sterile, nor were they peculiarly personal. However, they had been realistic and familiar. Hospitals, once they existed, functioned in particular as areas of hospitality and leisure, rather than as associations committed to curing disorder. Beds were arranged in long communal halls, mainly separated with the aid of curtains or easy partitions. Sufferers had been grouped in line with gender or sickness, depending on the resources on hand. Documents exhibit that some hospitals had targeted sections for those suffering from wounds, dermis ailments, or fevers, though these categories weren't at all times strictly enforced. Airflow was minimal, and heating used to be provided by wooden or charcoal braziers, cautiously tended to avert smoke inhalation. Bedding used to be easy, such as straw mattresses, woolen blankets, and from time to time linen sheets, if the university used to be well funded. The healthcare professionals every day seek advice from adopted or particularly standardized events. Upon entering the patient's house, the general practitioner would greet the patient, traditionally supplying a quick prayer or invocation. The examination started out with remark: the patient's complexion, behavior, posture, and respiration have been famous. Speech, when viable, used to be assessed for readability and coherence. Next came the inspection of the urine, an important factor of medieval prognosis. The urine was collected in an obvious glass flask, known as a urinal, and held up to the light. Its color, readability, odor, sediment, and consistency have been in comparison with reference charts or mental publications established on the uroscopy, Wheeler-fashioned diagnostic help within the period. The heartbeat might also be taken, though now not within the sense of counting beats per minute. Alternatively, the doctor positioned fingers on the wrist and assessed the fine of the pulse, whether it was robust, susceptible, rapid, slow, bounding, or irregular. These descriptors were interpreted within the framework of humoral concept. In some circumstances, the sufferer's feces or sputum had been examined, though this was much less common and frequently stylish. On the severity of the signs or the preferences of the practitioner, odor and taste had been additionally used diagnostically, albeit with caution. The belief used to be that each humor had its possessed odor and flavor, and that bodily secretions would expose the underlying imbalance. As soon as a prognosis had been formulated, the healthcare professional would proceed to prescribe a healing regimen. This normally commenced with dietary advice. Foods have been classified according to their humoral traits, sizzling or cold, moist or dry, and assigned. Thus, for illustration, if the patient was once believed to suffer from an OI over cold and wet humors, warming and drying foods corresponding to roasted meats, onions, garlic, or wine might be suggested. Conversely, if the sufferer used to be over cooling foods reminiscent of cucumbers, lettuce, or milk may be encouraged. Fasting was once mostly prescribed, though not ever too extra, and mealtimes have been adjusted to correspond with the rising and atmosphere of the sun. Beyond food regimen, the sufferer's environment was once also considered a part of the medication. Fresh air, reasonable exercise, quiet environment, and excellent smells have been all motivated. Rooms perhaps fumigated with aromatic herbs comparable to lavender, sage, or rosemary. Incense was burned not just for its scent but also for its supposed purifying homes. Mild used to be controlled utilizing curtains or shutters, and the alignment of the mattress used to be every so often adjusted in line with astrological suggestions or the waft of average gentle. The aim was once no longer in basic terms bodily comfort but the creation of a balanced and harmonious house where restoration might occur. Medicinal elements have been prepared either on-site or procured from an apothecary. These cures came in quite a lot of varieties: infusions, decoctions, syrups, capsules, powders, ointments, and plasters. Infusions have been made with the aid of steeping herbs in scorching water. At the same time, decoctions worried, boiling constituents to extract their active residences. Syrups had been sweetened combos, mainly used to make bitter constituents extra palatable. Pills had been formed with the aid of rolling powders with honey, wax, or plant gum. Powders have been taken dry or dissolved in beverages. Ointments and plasters had been utilized straight to the skin, produced from combinations of lard, beeswax, oil, and floor herbs. Long-established parts included fennel, mint, chamomile, anise, licorice, aloe, and myrrh. Animal-situated cures might comprise powdered antlers, beaten pearls, dried earthworms, and even substances comparable to burnt hedgehog skin, though these were used sparingly. Minerals reminiscent of sulfur, saltpeter, or alarm had been delivered relying on the recipes had been adopted cautiously, and education used to be guided by way of the function of the celebrities, the liturgical calendar, and natural capabilities. Some hospitals maintained certain lists of treatments and their functions, though many such documents have been misplaced over time. Bleeding used to be another fashioned practice, carried out to revive humoral balance. It was once performed using a lancet, a small sharp blade, and the method adopted a collection sample. The vein chosen relied on the sickness. For illustration, bleeding from the median vein of the forearm was once used to deal with complications, even as bleeding from the ankle, perhaps used for hemorrhoids or leg illnesses. The timing of the bleeding used to be foremost. It was adjusted consistent with the moon's phase, the patient's pulse, and the signs of the zodiac. After the system, the website online was bandaged with linen, soaked in wine or vinegar, and the sufferer was once allowed to relaxation quietly for a few hours. Leeches had been also used, especially when it was believed that mechanical removal of blood would be less fascinating. The leeches, most of the time amassed from neighborhood ponds or bought from visiting merchants, had been positioned on the dermis and allowed to feed. When they detached, the wound used to be handled with a slight astringent, though less invasive than cutting. Leeching was once time-consuming and no more predictable. However, it remained a revered system throughout a lot of the period. Cupping, the applying of heated cups to the dermis to draw blood to the skin, was an additional commonly used. Observe. Dry cupping, which failed to contain cutting the skin, used to be believed to alleviate congestion and give a boost to circulation. Wet cupping, which combined scarification with suction, was used for extra critical stipulations. Glass or ceramic cups had been used, and the suction used to be created via briefly inserting a burning fabric throughout the cup to heat the air. The procedure required care to restrict burns and was on the whole performed by barber surgeons or skilled assistants. Surgical approaches had been rare and on the whole reserved for outside accidents, abscesses, or obvious growths. Teeth extraction, cauterization, and hernia repair had been among the more original operations. Devices incorporated forceps, bone saws, probes, and cautery irons. Tools have been most of the time stored in leather-based or picket instances and cleaned between uses, though not to ultra-modern standards of sterility. Discomfort management used to be minimal. Natural sedatives reminiscent of poppy, mandrake, and henbane were administered in small doses. In some circumstances, the sufferer used to be given alcohol or certain to diminish motion. Postoperative care integrated the application of herbal salves, relaxation, and the avoidance of excitement. Midwifery formed a distinct branch of care, largely in the hands of women. Midwives were proficient via apprenticeship and experience. Their approaches were sensible and derived from long-standing lifestyle. They managed being pregnant, childbirth, and postpartum care, utilizing natural compresses, swaddling methods, and therapeutic massage. Instruments were minimal, frequently confined to towels, clamps, and simple surgical blades for emergency circumstances. Devout rituals accompanied start, together with the immediate baptism of toddlers. Complex births had been dangerous, and maternal mortality remained excessive. However, midwives were revered figures in lots of communities, and a few had been licensed with the aid of civic authorities in later centuries. Intellectual sickness, identified in medieval terms as melancholia, madness, or possession, was once dealt with a blend of prayer, routine, and herbal therapies. Remedies would comprise tract medication, the administration of calming herbs equivalent to valerian or lemon balm, and publicity to traditional settings. In devout settings, exorcisms had been generally conducted, though this trusted the perceived cause. There used to be no unified strategy, and responses diverse, largely established on neighborhood, severity, and the availability of knowledgeable clergy or healers. The patient's development was once monitored over time, with notes kept in some institutions. These notes, once they existed, have been in most cases temporary and recorded in Latin. They could incorporate the date of first examination, symptoms discovered, therapies administered, and whether or not the patient had multiplied, remained the identical, or died. Record keeping was no longer standardized, and plenty of entries were lost or destroyed. Nevertheless, some health facility registers from cities like Lyon, York, or Lubeck provide perception into the routines and effects of medieval hospital treatment. Discharge from care used to be determined via a return to function alternatively than a complete absence of signs. Patients who would consume, sleep, and move without help have been mainly viewed capable for discharge. They got dietary recommendations and non-secular advice. Some have been instructed to talk over with shrines, take medicinal baths, or proceed medication at residence. Comply with up care was once infrequent, and many relapsed as a result of persistent stipulations, negative hygiene, or the re-emergence of environmental factors. The purpose of care was once modest, to restore balance, relieve pain, and promote quiet convalescence. During this system, medication was understood now, not with ease as a scientific occasion, but as a religious and ethical experience. Physicians customarily collaborated with confessors, and patients were encouraged to evaluate their judgment of right and wrong as a part of recuperation. The road between ailment and sin used to be not constantly designated, and restoration used to be obvious as a sign of divine prefer. The administration of the sacrament of extreme unction was fashioned for many who neared dying. Anointing with oil, prayers for the soul, and ultimate confession supplied both alleviation and ritual closure. In the next and final part, we shall evaluate how the legacy of medieval clinical practice was once transmitted into the early trendy interval, how recommendations have been preserved, challenged, or quietly put aside, and how the gradual accumulation of observations and routines paved the way for later trends, all without the abruptness of revolution or the thrill of discovery, but alternatively by way of steady continuity and the persistence of addiction. Because the medieval world inched towards its conclusion, and the daybreak of the early ultra-modern interval began to take shape, the clinical structures and practices of the core a long time did not vanish rapidly or entirely. Rather, they remained in place for many years, functioning so much as they had for generations earlier, than with minor changes and sluggish shifts in emphasis instead than any unexpected overturning of long-held beliefs. The clinical worldview that had guided numerous sufferers and practitioners by means of centuries of illness, care, and slow restoration persevered to exert influence. Change came gradually, virtually imperceptibly, and in lots of areas, on no account for an awfully long time. The persistence of natural clinical tactics was once no longer special. In many towns, villages, and even inside cities, the perception in humoral theory, in astrological prognosis, in the balancing of the four fluids, and in the moral and religious dimension of ailment, remained dominant. Physicians, many of whom had studied at centered universities and realized from well-copied Latin treatises, still relied upon classical authorities such as Galen and Avicenna, even as some individuals began to raise questions or categorical quiet doubts about the accuracy of historical anatomy or the real nature of ailment. Such inquiries were most likely constrained to small circles and expressed in cautious language. In most parts of Europe, principally beyond the reach of greater city facilities, the expertise of medicine had modified little or no. A ailing character would seemingly still be cared for at residence or maybe in a small clinic affiliated with a monastery or religious condominium. A general practitioner, if one could be afforded or placed, may be summoned to examine the patient's urine in a clear glass flask, referred to as a urinal, and to present a diagnosis centered on its color, smell, and consistency. The healthcare professional might take the patient's pulse with just a few soft fingers on the wrist, and take heed to the document of symptoms supplied by using the loved ones or the patient themselves. If the patient was in a position to converse, cures remained conservative in nature, aimed at restoring balance instead than reaching a treatment. Bloodletting, natural teas, dietary advice, and rest had been the preferred treatments. The removal of excess bile or phlegm, the advertising of sweating, and the cleansing of the bowels via purgatives have been encouraged according to the patient's temperament and the season. Bleeding charts, still in circulation, were consulted to verify the most correct veins to open and essentially the most propitious days to perform the method, all based on astrological steerage. Surgical intervention, though rather extra refined in method than in prior centuries, remained rare and was generally confined to distinct instances reminiscent of abscess drainage, wound stitching, or the extraction of rotten tooth. Trepanning, or the elimination of a small element of the cranium, continued to be carried out in cases of head trauma or suspected possession. Although these operations had been carried out with the utmost caution and only when all different cures had failed, the devices used, including saws, knives, and cauterizing irons, had been maintained with care but most often reused, as assets had been restricted. The printing press, offered within the mid-15th century, had a slow, however, consistent influence on the dissemination of clinical texts. Books that had previously been copied painstakingly by way of hand might now be printed in more than one copies, making ordinary works extra greatly available. Nevertheless, literacy charges remained low among the many common population, and many clinical texts persisted to be written in Latin, which limited their readership to the trained elite. Even so, the provision of printed substances allowed for a more constant transmission of potential among university-informed physicians, and a few commenced to collect manuals that incorporated case reports, private observations, and local adaptations of classical teachings. Folk remedy and loved ones' cures remained a primary source of deal with many. Ladies, traditionally excluded from formal scientific education, persevered to play an role in therapy by means of the practice of poultices, tinctures, and broths. The usage of honey, vinegar, garlic, onion, and more than a few herbs endured. handed from mother to daughter or between neighbors. The appliance of healing prayers, charms, or amulets likewise persisted. Particularly in rural areas, the place access to legitimate care was once scarce. The mixing of religious and bodily remedy remained deeply embedded within the tradition of the time. Plague, which had visited Europe repeatedly since the mid-14th century, remained a source of fear and confusion. Though efforts had been made to have an understanding of its causes and patterns, explanations persisted to focal point on dangerous air, corrupted environments, divine punishment, or unfortunate planetary alignments. Quarantine practices had been offered in some port cities, and officers sometimes enforced public well-being measures, such because the cleansing of streets, the isolation of the in poor health, and the limit of journey. Still, the abilities of how ailments spread remained limited, and clinical responses to epidemics were generally palliative. It's valued at noting that even with the aid of the end of the 15th century, the anatomical skills of the human physique remained mostly unchanged from what it had been within the early core ages. Dissection had emerged as extra accepted in some scientific schools, especially in Italy. Yet it was customarily conducted below strict supervision and often using the hour bodies of carried-out criminals. These anatomical demonstrations were not necessarily used to venture old texts, however, alternatively to affirm them. Deviations from classical teachings had been normally explained away, alternatively, then taken as proof of error. True anatomical revision would no longer arise, except later, with the work of members similar to Andreas Vesalius, whose contributions, at the same time massive, came simply after the shut of the medieval interval. Clinical licensing, which had been slowly offered in detailed regions, remained uneven and restrained in scope. Some cities required practitioners to go examinations or register with civic authorities. However, enforcement used to be inconsistent. Many healers persevered to observe without formal approval, notably in rural areas. The place possible choices have been few. Barbers, midwives, and lay surgeons probably operated external the boundaries of college-trained medication, but they remained principal participants of their communities, their practices. At the same time, many times criticized with the aid of physicians, persevered because of their accessibility and familiarity. Religious attitudes toward healing began to shift, but handiest moderately. While the Church had continually supported the care of the sick as a form of Christian charity, there used to be a growing tolerance for the idea that bodily illness might have typical reasons, and that finding out concerning the physique would be a useful pursuit. Still, the spiritual dimension of medication remained distinguished. Monasteries persevered to preserve herb gardens, host pilgrims, and present alms and care to those in need. Saints continued to be invoked, relics endured to be touched, and prayers for well-being were still uttered with quiet regularity. In this context of continuity, minor innovation, and cautious reflection, the medieval period drew to a detailed, the best medical transformations that would later outline the early modern-day era were still in their infancy. No radical break had came about. The arena of medieval treatment, with its sluggish rhythms, its handwritten treatises, its reverence for the ancients, and its integration of religion and healing, remained mostly intact. For most persons, lifestyles and ailment endured so much as that they had for centuries formed by means of season, circumstance, and the gradual passage of time. And so, the story of medieval medicine ends now, not with a revolution, however with a lingering tradition. The talents preserved in manuscripts, the methods passed down with the aid of word of mouth, and the smooth, repetitive rituals of care remained in use good into the next centuries. It used to be a world the place cure used to be, as so much about patience as precision, as a lot about prayer as follow. The body was handled, the spirit was tended, and time itself used to be allowed to work its quiet path. In closing, the query of how evolved medicine used to be within the middle a while need to be answered now, not with a judgment of success or failure, but with an appreciation for continuity, for cautious studying, and for the deep persistence of strategies. Over time, the medieval process to medication, although confined by way of modern-day necessities, was once rooted in a coherent worldview, practiced with care, and adapted with quiet diligence. Its legacy, although muted, stays embedded in the history of therapy, as this lengthy and smooth experience, by means of medieval remedy, concludes. We are left no longer with drama or revelation, but with a peaceful and lingering echo of a world The place healing used to be gradual, soft-spoken, and reverent. The candles are extinguished, the manuscripts are closed, and the day attracts to a quiet finish.